Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
The distension media used in hysteroscopy. In diagnostic hysteroscopy, the medium used is carbon dioxide for distension, and operative hysteroscopy. In operative hysteroscopy, the medium used is fluid. So if the fluid is we can either use an electrolyte rich fluid or electrolyte deficient fluid. Electrolyte rich fluid is used in ringer lactate, normal saline, and electrolyte deficient fluid. Electrolyte deficient fluid is used in glycine 1.5% most commonly, sorbitol 3%, and mannitol 5%. In electrolyte rich fluid, there will not be hyponatremia. Hyponatremia is not seen in electrolyte rich fluid. Electrolyte deficient fluid, hyponatremia is seen in electrolyte deficient fluid, and you will also see fluid overload in electrolyte deficient fluid. Electrolyte rich fluid is the only use for electrolyte rich fluid is bipolar cautery. The only use for electrolyte deficient is bipolar plus unipolar cautery. Fluid deficit. Fluid deficit is the difference between the outgoing fluid volume and the ingoing fluid volume. If in electrolyte deficient medium, if the fluid deficit is more than or equal to 1 liter, that is the difference between the outgoing fluid volume and ingoing fluid volume, that is there is more ingoing fluid volume in our body, that means that this has resulted in fluid overload. So if this fluid deficit is more than or equal to 1 liter in electrolyte deficient medium, then we will have to stop the procedure. If the deficit is found to be more than or equal to 2.5 liters in electrolyte rich medium, then we should stop the procedure. I
thank you and thank you for watching.